International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Health is really not what doctors do, and health is not what systems do. Health is what people do.
2008-9, as in many countries, public funding collapsed, and so everyone was looking into the abyss. A system which had been highly organized, highly integrated, highly funded, suddenly started to look into an abyss of no money. The alternative was put out there, it's chaos. It's either everything is completely centrally organized, or it's going to be total chaos. By 2014, the Dutch introduced the participation law, which effectively decentralized a lot of particularly community and public mental health services back down to local government. Effectively, the central government said, we don't have the money, please guys sort it out. There wasn't really much more of a plan than that. So the local governments had to somehow come up with a solution to this problem. There's got to be some alternative. We can't just be either everything centrally managed, centrally funded and very well organized, or as chaos. There's got to be some sort of middle road. It was no longer the central public health administration managing contracts and organizing everybody, telling everyone what to do. Everything was well organized, well settled and followed according to protocols. It started to become a network manager, a network facilitator. And so this paper, if you like, it's not the solution here. It's simply asking the question in a different way. Does the world end when integration stops? And it doesn't. We need to start thinking of a different way of describing health system. We've got a scientific level. We talk about non-hierarchical organization and this kind of thing. But we also need a sort of political marketing level. So we call it an open network health system. Because currently, in policy dialogue, you will have integration, and the opposite to integration is fragmentation, chaos. And what we're saying is the opposite is not fragmentation, the opposite is not chaos. The opposite is open cooperation. I don't think we have found the perfect solution yet, but the paper starts to describe a clear case study.
Health is really not what doctors do, and health is not what systems do. Health is what people do. Now that kind of thinking allows you to include a healing element of society and so on immediately in the healthcare process. The aspect of the open system, which is very problematic, I think, is how do people break down the resistance to one another's cooperation in terms of their own particular needs to maintain their identity and to maintain their group and maintain their funding and the whole business. The most difficult thing is for the leadership to give up their responsibility for running the whole health system. The health is, again, not what systems do. Health is actually what people do. And how can the system take a different role, a more facilitatory role, a monitoring role, a protective role, but not necessarily bossing the role, and let the boss come from the bottom up? And I think that's the basic elements that we see is what would keep the open system moving and why it's essentially necessary and has been in place in history in various points of time and in different cultures and points in time, and always leads to change and possibility. And while it may seem chaotic, it's not. It's actually the basis of health.